Pimple popping is a very big thing. Why shouldn't you do it?
Pimple popping is the commonest thing young boy or girl do. What you are doing, you are just trying to take it out. So that makes it bad.
जब भी एक्ने होता है लोग टूथपेस्ट लगा देते हैं होप कि वहाँ पे स्पॉट पे लगाएंगे तो हट जाएगा.
It is not to apply on your skin. It is to be applied on your teeth. So all these things can do harm actually after that.
Which diet is better though for skin? Veg or non-veg?
There is nothing such. Fried food or dosa or uttapam, nothing. A person who is a veg as a giant food, they will have glass skin with a pure without pimples. ऐसा तो होता नहीं.
Milk से एक्ने नहीं होता?
Largest consumption of milk or milk product is in Denmark, Canada, New Zealand. There is no evidence. Highest number of pimples in that country. There is no.
Celebrities, उन्हें एक्ने क्यों नहीं होता?
The celebs, they come to our clinic.
लोगों को एक्ने की वजह से भी स्ट्रेस होता है.
Yes, whenever the skin is not feeling well, your mind is also not feeling well. 45-year-old person may not be that serious about it. A 15-year-old boy is always very much affected by it. यहाँ 3-4 पिंपल आ गया, यहाँ पे एक white patch आ गया, he'll get mad.
At what point acne becomes a disease?
So
हम सबको हेल्दी स्किन चाहिए, इसीलिए हम एक स्पेशल सीरीज लेके आए हैं जिसमें हम एडवांसिंग स्किन हेल्थ फॉर एवरी स्किन स्टोरी के बारे में बात करेंगे विथ सेंसिटिव स्किन एक्सपर्ट सेटअप है. जब भी एक्ने होता है हम होम रेमेडीज ट्राई करते हैं, फ्राइड फूड अवॉइड करते हैं, लेकिन क्या ये सब एक्चुअली काम करता है? क्या फूड और एक्ने का डायरेक्ट रिलेशन होता है? मुल्तानी मिट्टी जैसे ट्रेडिशनल रेमेडीज हेल्पफुल है या हार्मफुल? अल्कोहल और स्मोकिंग का क्या इफेक्ट पड़ता है स्किन पे? पीरियड से पहले एक्ने क्यों होता है और एक्ने को ट्रीट कैसे कर सकते हैं? ये पूरा एपिसोड एक्ने के हर एक क्वेश्चन, हर एक प्रॉब्लम को आंसर करने की कोशिश करेगा विथ हमारे आज के गेस्ट डॉक्टर कौशिक लहिरी, डर्मेटोलॉजिस्ट एंड डर्मेटोसर्जन विथ ओवर 3 decades of experience. He is one of the most senior doctors in the country. इस एपिसोड को एंड तक देखिए जानने के लिए कि आप एक्ने कैसे अवॉइड कर सकते हैं एंड ट्रीट कैसे कर सकते हैं. एंड मुझे एंड में कमेंट्स में बताना कि आपको सबसे हेल्पफुल इनसाइट कौन सी लगी और सबसे शॉकिंग बात कौन सी लगी. Dr. Lahiri, welcome to Figuring Out.
Thank you, Raj.
Our today's topic is going to revolve a lot around acne. And I want to understand what is happening, why is happening, why everybody is getting acne and it's increasing day by day. The numbers are increasing. So what do people get wrong about it?
If we want to single out one thing, that is everybody thinks that it is due to bad hygiene. So, and sometimes the parents comes to us and tell, वो बहुत ज़्यादा फ्राइड फूड ले लेते, मेरा बच्चा देखिए सर वो फूड हैबिट गलत है. एंड समवन विल टेल उसका कंस्टिपेशन है, एंड समवन विल टेल सर ये तो पिंपल्स तो निकलेंगे, वो तो रात को 3-4 घंटे ज़्यादा से ज़्यादा सो लेते. सो एवरीबडी थिंक्स अबाउट these things which are not always scientific.
Okay.
Nothing to do with this wrong food habit or like a sleeping habit. और the main thing is our hygiene. हाइजीन के साथ कोई रिलेशन है ही नहीं इसका.
Really?
Yes, absolutely.
Okay.
So अगर हाइजीन के साथ होता तो दिल्ली is now the most polluted. You think that is the highest number of acne is in Delhi और in हिमालय में कोई होता नहीं, कश्मीर में कोई होता नहीं, ऐसा तो नहीं है ना. The highest number of acne vulgaris we get it in Europe, which is not exactly that polluted like our country. So think from
and the food habit is also not as bad as America. So if it's Europe is bad, then interesting. I didn't know about it.
Yeah.
There are few things जो बहुत weird है which I found out, and it is actually becoming a thing. थोड़ा वो trend बड़ा बनते जा रहा है in certain countries. And I was fascinated, and at the same time I was shocked. So I want to go through that. Okay. एक थी leech therapy. Have you seen?
Yes.
You've seen?
I've not seen. I know that in
you
Southeast
know, like
Asia,
you've seen videos and stuff.
Yeah, in Southeast Asia, snail therapy, leech therapy.
Leech therapy pimples के लिए लोग यूज करते हैं. वो leech एक आपकी स्किन पे छोड़ देते हैं. I saw a video and then जैसे वो blood suck करता है.
Because this is from a wrong notion. There's something is in your skin which is impure. To suck out that impurity from your skin. These are all ridiculous, bogus, absolutely wrong therapy. And you should not ever indulge in that.
Never.
Then
there was a lot of people have started using their own urine to apply on pimple. Have you heard that?
Yeah, I know that. This is nothing new. Again, this is for years, ages it's going on. Urine is actually sterile if it is from a healthy person. If that person is not suffering from any disease or not suffering from urinary tract infection. So whatever he does with urine, applying, or some great person used to drink their own urine. So that was, and they thought that if I take this will pure my system. That is wrong. Because through urine, whatever the wrong products from our body is supposed to be excreted out, the body is excreting. That's a very, very methodical scientific system. So if you are taking it again, so that's wrong. Something you are going against the nature.
Yeah. Then there is semen facial.
Yeah, I know that. So again,
that is also bad.
Absolutely no science behind this.
फिर लोग इतना करते क्यों जाते हैं? Hype क्यों बनते जा रहा है ये?
So hype is hype. Hype is hype. Because you don't need any reason, rhyme and reason.
But there has to be some results. किसी को कुछ affect करा होगा, इसीलिए लोग बोलते हैं ना ये करवाने के लिए.
देखो, for pimples, even if you don't do anything, most of the pimples they are not cystic, nodular cystic or nodular. Most of the pimples are mild to moderate. So even if you without doing anything, it will subside, and you will think that वो जो लगा लिया उसके कारण ये ठीक हो गया.
Okay, then. This is something unusual or bizarre I've heard, but ये एक friend के साथ हुआ था. So common on the internet also it's there that sex will decrease acne. And one of my friends, she went to the dermatologist and dermatologist ने उसे बोला कि आपकी शादी नहीं हुई है, इसकी वजह से आपको acne हो रहे हैं.
Absolutely no evidence behind this. Absolutely
but this happened like with a dermatologist and a friend. I'm like, is this true?
I don't want to comment on that. I'm not sure whether he or she is a dermatologist who has told this.
It was actually
if a person is sexually active, his pimple will come down, and if it's someone is sexually not active, his pimple will go increase. Nothing to do with that. This all depends on race. Not exactly race. It all depends on your family background. In some family, you have absolutely glass skin. In some family, all the family members, they have some scars on the face. So it depends on that, and the stress, and all the wrong things which you're applying on the skin. So all things contribute, but nothing to do with any particular diet or the sleeping pattern. Stress is definitely one important factor. Definitely.
So you mentioned diet. Milk se acne nahi hota?
Again, there's no evidence. This is a big myth. This is a big myth because agar hota hai to the largest consumption of milk or milk product is in Denmark and in Canada, in New Zealand, ज़्यादा dairy product hota hai. So there's no evidence that the highest number of pimples in that country. There's no. Even in our country, the milk production may not be that high. Even a village boy or a girl, he or she may not have access to that kind of milk or milk product or dairy product or big chocolate every day. They may not purchase all these things. They also have pimples.
So there's no evidence for milk.
No 2 + 2. There may be some other reason. But high glycemic diet always, डॉक्टर साहब ये बहुत ज़्यादा fried food लेते हैं मेरा बच्चा इसीलिए हो जाता है. No.
Fried food से भी कुछ नहीं होता.
No. And in our country, डॉक्टर साहब ये तो बिरयानी बहुत लेते हैं. So बिरयानी के साथ जोड़ लेते हैं. Fried food बहुत ज़्यादा लेते हैं. वो स्ट्रीट फूड बहुत ज़्यादा लेते हैं. स्ट्रीट फूड, बिरयानी, फ्राइड फूड ज़्यादा नहीं लेना चाहिए. दैट इज़ गुड. दैट इज़ व्हाट द पेरेंट इज ट्राइंग टू टेल इज़ गुड. बट अगर एक 14, 15, 16 साल का लड़की ना ले तो 60 साल का कोई बुढ़ा लेंगे? भाई लेने दो. आफ्टर 3 or 4 years he will not take it. Why you are ruining his life? भाई इसके साथ इसका स्किन का कोई रिलेशन नहीं है. Absolutely.
I can't, I don't have words, really. I've always thought and understood कि fried food causes pimples.
No.
Always.
No. There's no relation with fried food or dosa or uttapam or North Indian कोई food या Bengali माछ भात or South Indian tikha कोई chettinad chicken. No, nothing. Because a person who is a veg as a Jain food, they will have glass skin with a pure without pimples. ऐसा तो होता नहीं.
तो वेज एंड नॉन वेज डाइट से भी कोई फर्क नहीं पड़ता.
No.
Which diet is better though for skin? Veg or non-veg?
There's nothing such. Whatever is good, whatever you love, you can take. It's very, very scientific and democratic world. Whatever you love, you take. You're comfortable with.
Okay. I have a question.
Until and unless you are allergic to any particular food, you should avoid that. That's all.
Allergies are different.
That's a completely different thing. Or some you have some like a milk intolerance from your childhood. You cannot take any milk product. You know that. Your parents always
lactose
know
intolerance.
Lactose intolerance. Don't take it. That's all. Simple.
But nothing to do. Otherwise, normal human being में कुछ नहीं दिक्कत है. Very. वाह, मुझे लगा था कि आज मुझे पता नहीं कितने खाने की चीजें बता दोगे कि ये सब नहीं लेना चाहिए. I was going through Google for the research of this podcast.
Google Baba.
Okay, Google Baba के बाद, and I was finding what all people do, and they claim that ये work करता है, and इसकी वजह से ये trend बन गया है, तो बहुत सारे और लोग करने लग गए. So I'll ask you one by one. Okay. And फिर मुझे बताना कि इससे होता क्या है, and कुछ होता भी है कि नहीं होता है.
Go ahead.
या खराब क्या करते हैं. Okay.
Sure.
First thing I saw कि जब भी acne होता है, लोग टूथपेस्ट लगा देते हैं अलग-अलग. जितने टाइप के टूथपेस्ट जो लगाते हैं वो लगाते हैं इन होप कि वहाँ पे स्पॉट पे लगाएंगे तो हट जाएगा. एंड इट्स अ बिग थिंग. होता है ऐसा कुछ?
टू सम एक्सटेंट देखो, उसमें थोड़ा एंटीबायोटिक एंटीसेप्टिक प्रॉपर्टी तो होता है, बट समटाइम्स उससे भी थोड़ा केमिकल बर्न भी हो सकता है. सो यू डोंट नो अबाउट द pH वैल्यू. यू डोंट नो बिकॉज इट इज नॉट टू अप्लाई ऑन योर स्किन. इट इज टू बी अप्लाइड ऑन योर teeth. So the pH is different, and on the skin, if you apply something which is corrosive, that can give rise to contact dermatitis. And so you're applying for not 2 minutes, you're applying for 2 hours paste. So all these things can do harm actually after that.
क्या harm होगा उससे?
So after that, the post-inflammatory hyperpigmentation हो सकता है. What you call scar, not exactly scar, थोड़ा black pigmentation बन जाता है. So that is also not correct.
तो अगर पेस्ट लगाया ज़्यादा देर तक रखा तो actually burn कर सकता है और वो scar दे देगा.
Yes.
So it's people should not do it.
No.
But उससे बहुत लोग बोलते हैं कि हट जाता है पिंपल.
पिंपल देखो अपने आप ही हट जाता है ना. Naturally, most of the pimple that get when we were young, I don't think our parents ever took us to dermatologist clinic, wait for 3 hours for treating our pimples. But these days, that is 25% of our total patient strength is for pimples. Pimple is not that simple.
Then लोग यूज करते हैं एप्पल साइडर विनेगर. वो स्पॉट्स पे लगाते हैं. उससे कुछ होता है?
No, absolutely no. And it burns that area. That it is apple cider vinegar. We have seen a lot, not only for pimples but for pigmentation as well. Suppose किसी का underarms में pigmentation आ गया, आँख के नीचे pigmentation आ गया, यहाँ पे पिंपल के बाद पिगमेंटेशन आ गया, वहाँ पे एप्पल साइडर विनेगर लगा लिया, उसके बाद बहुत ज़्यादा बर्न हो गया उस जगह. वी कॉल इट इरिटेंट कंटैक्ट डर्माटाइटिस. दैट इज द करेक्ट टर्म. वो इरिटेंट कंटैक्ट डर्माटाइटिस हो जाने के बाद दैट एरिया गेट्स reddish, that area becomes like irritated. The person feels initially itching, उसके बाद थोड़ा burning sensation हो जाता है, and whenever going out in the sun, that even makes the situation worse. Apple cider vinegar is not at all a good idea, and उसके साथ जो लगाते हैं that is also your lemon juice लगा लेते हैं. तो लेमन जूस के अंदर भी ये दिस आर हाईली एसिडिक. 4.4 4.5 उसका pH वैल्यू होता है. तो एप्पल साइडर विनेगर इज आल्सो एसिडिक, हाईली एसिडिक. अगर लगा लिया यहाँ पे, दैट एरिया विल बिकम डार्क. सो विल गो टू द डॉक्टर रनिंग दैट ये लगा लिया, ये हो गया. कैसे हो गया? क्योंकि हम लेमन जूस लगा लिया, उसके ऊपर एप्पल साइडर विनेगर लगा लिया. सो जो भी नहीं करना चाहिए आप सब करके आ रहे हो. सो लेट इट बी. भाई पिंपल जैसा है छोड़ दो, डॉक्टर साहब के ऊपर छोड़ दो. दैट इज इजियर टू ट्रीट. एंड इफ यू want to make it a complicated like a pimple after doing all the popping and taking a mirror in front of you and doing this. Do you think it's in the whole world we have 7.5 billion, right? When I last counted people. Do you think anyone has the time to take a magnifying glass and go in front of you and अच्छा यहाँ एक पिंपल आ गया है, एक पिंपल आ गया? No. You are bothered about your skin. The whole world is not that interested.
But pimple popping is a very big thing, right? Why shouldn't you do it?
It is.
तो क्यों नहीं करना चाहिए?
It is a good question. Actually, pimple popping is the commonest thing a young boy or girl do. They're always very much disturbed about that pimple. And because we were just joking, but these days, क्या होता है? We all are on social media. We are taking selfie. That is one.
Yeah.
Like screens are in front of you, like this. Everybody is looking as अच्छा उनका देखो यहाँ पे एक है. So everybody is looking at your face from 3 inches distance. पहले का जमाने में नहीं था ये. So that's why they are bothered and they are taking a mirror and doing this, applying something, apple cider vinegar, whatever. क्यों नहीं होना चाहिए? Popping क्यों नहीं होना चाहिए? Because you are not a doctor. You don't know how to do it. As a doctor, we know how to do the puncture, how to use the comedon extractor, how to properly take care with a sterile instrument, take out the comedon, and if needed, we can inject the steroid. We can do whatever in a proper way, in a trained medical supervision. But you are not a doctor. You are just, what you are doing, you are just trying to take it out, whatever is there. उसके बाद क्या लगा रहे हो उसके ऊपर? जो भी है घर में लगा लिया. कल टूथपेस्ट लगाया, आज एप्पल साइडर विनेगर लगाया. So that makes it bad. Leave it. Consult a qualified dermatologist.
Pop करने से कोई side effect होते हैं? कुछ harmful होते हैं? Harm होता है?
Yeah. 3-4 things. You're not sure that your hands are clean or not. All the bacteria, they are lodged just here. You're just beneath your nails.
Okay.
So whenever you're popping, the bacteria is very happy to go inside that area. That area is already overfilled and you are giving some extra force who are actually terrorists.
तो होगा क्या उससे?
बोलो, आप ही बोलो. उसके बाद उसके ऊपर इन्फ्लामेशन बढ़ जाएगा. इन्फ्लामेशन बढ़ जाने से उस जगह रेड हो जाएगा, उस जगह पे पास आ जाएगा, पीप आ जाएगा. एंड दैट एरिया फ्रॉम पैप्यूल टू पस्ट्यूल टू नोड्यूल टू सिस्ट हो जाएगा. स्कार हो जाएगा. स्कार हो सकता है या तो पोस्ट इन्फ्लामेटरी हाइपरपिगमेंटेशन हो सकता है. वो एरिया गड्ढा भी हो सकता है. सो एवरीथिंग व्हिच आइडियली शुड नॉट, यू आर डूइंग इट. या
और फिर और ज्यादा वर्स करता है.
We call it like a rural handicraft. Handicraft, you हाथ से क्या ना सब कुछ.
Then नीम की पत्ती यूज करते हैं, नीम लीव्स.
Yeah, that is again a myth. For older days when there was no antibiotic, antiseptic, वो क्या करते थे? वो नीम लेके hot water के ऊपर उबल के लगा लेते. ये सब thinking that will cure all the elements.
कुछ होता है?
That is to some extent very low like a anti-yeast antibacterial property है नीम के अंदर.
अच्छा.
But we should not like focus on that because क्या होता है वो जो लगाते हैं ना 1 महीना पहले वो करके रख दिया घर में and that is completely in a bad situation. वो 1 महीना पुराना जो वो लगा रहे हो उससे भी प्रॉब्लम हो जाता है.
Another thing we will do is मुल्तानी मिट्टी.
Yeah, I don't know what is there in. I have never been to Multan. Multan के मिट्टी कैसे होता है? Don't know, and whether this Multani मिट्टी is really from Multan, I also don't know. Again, these are all myth.
So Multani mitti is a full industry. There are a lot of products like that.
Nothing has to do with dermatology. It's unfortunately zero.
People drink every morning, na? There's a medicine जो बहुत पॉपुलरली टीवी पे ऐड भी आता है.
आई डोंट वांट टू कमेंट बिकॉज जिसका जितना ज़्यादा एडवर्टाइजमेंट का ज़रूरी होता है उसका अंदर उतना ही कम मटेरियल होता है. आवर डर्मेटोलॉजिकल मेडिसिन्स दीज आर नॉट एडवर्टाइज्ड टू द मीडिया. अ डॉक्टर प्रिस्क्राइब्स एंड देन
तो जो वर्क करती है उसको तुमको एडवर्टाइज करने की जरूरत नहीं पड़ेगी.
एब्सोल्युटली.
ऐसा हर बार नहीं होता, बट आई गेट व्हाट यू आर ट्राइंग टू से. Well, there are few products you need to advertise and then they work also. ऐसे
Yeah,
थोड़ी है.
actually there are two worlds. One is the prescription based, one is non-prescription based. Globally that is accepted. जो over the counter product जो होता है, and there's another category which is prescription based. So prescription based is definitely by the qualified dermatologist or qualified doctors. Non-prescription based, this will not do any harm, first of all, but they may or may not do anything good on your skin. But India में क्या होता है, this is blurred actually. There is no prescription products. These are also available without prescription. Anything and everything. I'll just write on a scribble on a piece of paper. You'll go to the local pharmacist. Everything is available.
Even if you don't write, I can go ask.
Yeah. थोड़ा एक भेंट दे दीजिए, वो आपको दे देंगे. क्या है?
You know, but sometimes I have started using products which were great because I saw an advertisement, or at least it suited my skin, or maybe not advertise on TV but advertise in a shopping mall, or advertise कहीं इधर उधर देखा, कहीं पोस्टर देखा, something like that, या किसी ने मुझे suggest किया वहीं पर. So there are things that has worked for me. Like I use a face wash of Kiehl's. I really like it. I think it suits my skin very well. Then Cetaphil, I found out a moisturizer.
Yeah.
I started using since 1.5 years. I'm really enjoying it.
These are two worlds actually. What I was discussing, I was ridiculing not brands. These are local made, and you are not sure about the science behind it. And what you are mentioning is scientific products. So they are coming from big companies. They are coming from prolonged research and evidence and trials on many individuals over the years, over decades, and then they are allowed to be in the market without prescription. So that is good. There's absolutely nothing in that.
There's a common saying, oil cleansing, कि फेस पे बहुत सारा लोग ऑयल लगा लेते हैं एंड ऑयल क्लेंजिंग यूज करते हैं ताकि फेस और बेटर हो जाए या फेस से एक्ने चले जाए. Do you think that's right?
No. Why pimple happens? Pimple happens because of overproduction of oil from the body, right? And in this particular age group, teenage group, when the body is producing much more oil due to the androgen, the male hormone. And ज़्यादा ऑयल और सिबम सिक्रेशन के कारण क्या होता है, क्लॉगिंग हो जाता है, पोर जो होता है ना, क्लॉग हो जाता है, उसके ऊपर एक बैक्टीरियल इन्फेक्शन हो जाता है और इन्फ्लामेशन हो जाता है. दीज आर द 4 points. तो जो ऑयल है, जो स्किन आपका ज़्यादा ऑयल प्रोड्यूस कर रहे हैं, उसके ऊपर अगर ऑयल लगा लो तो क्या होगा,
और खराब होगा.
So this is ridiculous. This is absolutely ridiculous.
Okay, why do celebrities उन्हें एक्ने क्यों नहीं होता? Like their skin is always looking flawless, and why is that?
The celebrities, you're also a celebrity, and celebrities, we look at them at the screen, right? That is also before that shooting, that they have a grooming time, makeup, everything, and this is the final product on the screen, what you are looking at. That's not the real thing. Because the celebs, they come to our clinic without any makeup. They're absolutely normal like us. So they also have pimples. They also have their issues with the skin. But it is a myth that their skin is flawless. So they know when to shoot and what is the best time to shoot. So that's all.
पर फिर हर कोई obsessed है, हर किसी को celebrity like skin चाहिए.
So there's nothing wrong in that perception. The celebrity like skin chahiye. That means you want a healthy skin.
But celebrity like skin, if you're telling कि celebrities doesn't have better skin, मतलब वो सब makeup है, then why is it a thing कि celebrity like skin?
ऐसा नहीं है, सब makeup है, ऐसा नहीं है. They definitely look better than average human being. But it's not that they are always fairer. They are always the skin is shinier. They never had acne. They never had any hair loss. They never had any post-inflammatory hyperpigmentation. ऐसा भी नहीं है. They all yeah.
But कुछ ऐसे नहीं होता कि कोई मेडिसिन ले ली, कोई स्पॉट करेक्टर लगा दिया, कोई I don't know, कोई इंजेक्ट कर दी.
Injection definitely, but these all will take time. 7 days, 5 days, 7 days, 10 days. ऐसा नहीं होता है एक दिन के अंदर ठीक हो गया.
24 hours में कुछ भी नहीं होता.
नहीं.
There's nothing, कोई steroid या कुछ injection भी नहीं.
I'll never tell that. Never. That is unethical. Because steroid, if you just Google about TSDF and Lahiri, TSDF is a horrific thing. That is topical steroid-dependent face or topical steroid-damaged face in India. You can Google that is TSDF, and उसके साथ मेरा नाम जोड़ गया. For last 20 years we are working on that. Only in India it happens. देखो, अगर किसी का बुखार आ गया तो बुखार कोविड से हो सकता है, किसी का
थ्रोट इन्फेक्शन हो सकता है, वायरल से हो सकता है, कोई किसी का ट्यूबरकुलोसिस हो सकता है, मलेरिया हो सकता है, कोई भी कारण. तो डॉक्टर साहब तो ऐसा ही नहीं देते ना, थोड़ा टीबी का दवा, थोड़ा मलेरिया का दवा, थोड़ा कैंसर का दवा मिला के आपको दे देते. ऐसा तो नहीं करते ना. क्या करते हैं डॉक्टर साहब? डू सम इन्वेस्टिगेशन, व्हाट इज द डिजीज, देन पर्टिकुलर. तो स्किन के ऊपर क्या होता है? स्किन के ऊपर एक पिंपल हो गया और कोई भी लीशन हो गया तो वो कोई झोला छाप डॉक्टर साहब के पास चला गया, और डॉक्टर साहब भी नहीं है, झोला छाप के पास चला गया और उसका तो पता नहीं है क्या हुआ. वो थोड़ा स्टेरॉयड, थोड़ा एंटीफंगल, थोड़ा एंटीबायोटिक मिला के दे दिया आपको, जो भी है मर जाएगा. तो वो डिजीज भी मर गया, आप भी मर गया, सब एक साथ. So that is the problem in our country. And after that, the steroid, once you start it, just like tobacco is just like alcohol. Addiction.
Once you start taking it, after that it will start taking you. And it's very difficult to come out of that. It's 1,000 crore rupee business in India. And we did a big study in 2009, and that tells about 60% of our steroid abusers, without any rhyme and reason, they're applying the strongest steroid, they're applying on the face. And again, 90% of that is unethical. Without any prescription, they're applying. So we have all the data, and that is very, very unfortunate.
लॉन्ग टर्म में क्या होता है? कोई स्टेरॉइड्स किसने लगाया? क्योंकि यूजुअली लोग तब लगाते हैं जब उन्हें कुछ उम्मीद होती है कि मे बी एक्ने चले जाएगा या मैं फेयर हो जाऊंगा. स्टेरॉइड्स यूजुअली लोग कलर के लिए लगाते हैं.
दो कारण है, 2-3 कारण से लगाते हैं. एक तो है पिंपल के कारण,
हाँ,
पिंपल ठीक हो जाएगा, और स्टेरॉइड से ही पिंपल होता है. दिस इज वन. नंबर 2 इज फेयर बनने के लिए, थोड़ा लड़की थोड़ा गोरा बनने के लिए थोड़ा लगा लिया. एंड वी हैव सीन एक्चुअली 3 महीने का लड़की, इसका शादी करना है डॉक्टर साहब, दे हैव स्टार्टेड अप्लाइंग दैट वेट. आई एम नॉट टेकिंग द नेम अगेन, द फेमस वेट इंडिया में जो मिलता है.
3 महीने की बच्ची में
1 tube is getting finished in 3 days, 2 days, and that baby is absorbing the steroid, and baby is getting fatter. You can't imagine. I'll send you the photos. You'll just feel like crying. There's a criminal offense, and they don't know because डॉक्टर साहब इसका शादी के लिए इसका जरूरी है, ये इतना काला है.
तो 3 महीने का बच्चे का थोड़ी शादी कराना है. लाइक इट्स आज से करेंगे तो बेटर होगा.
So I was honored by the American Academy of Dermatology for member making a difference. The moment when I was taking that, when I was about to tell something, they told that Dr. Lahiri, you tell one sentence, whatever comes to your mind right now. I told that I'm very happy for this honor, but at this particular moment, there are at least a few thousand mothers who are purchasing that for their girl child, or they're applying on their face to get fair. So that is the reality we don't address. We don't address. And through your channel, I'm telling everyone with folded hands not to apply anything from the local chemist shop लेके कुछ भी चेहरे पे मत लगाओ, because this is your most precious like a thing. So क्यों आग लगाते हो उसके ऊपर? There's no reason, and that will leave with a permanent scar, which the best doctor cannot do anything about.
And then how to get out of that?
सबसे जो strongest steroid से mid potent to low potent ऐसा नहीं होता है. Now the latest theory is stop steroid immediately. Whatever the patient is, tell him or her that you will suffer for some day. But ultimately, this is the way.
So is there specific reason कि हर age पे क्यों acne होते हैं? Because I was going through studies that teenagers, almost 80 to 90% teenagers go through acne. Almost 50% of young adults go through acne. Almost 20 to 30% of 30 to 50-year-olds go through acne. And even older people who are above 50, 10-20% उनमें भी acne होते हैं.
Excellent, very good question. I'm very happy with this question. देखो, even newborn girl or boy can have acne. That is due to the neonatal acne. The mother's हार्मोनल जो प्रोटेक्शन था वो हट गया, उसके कारण होता है. दैट इज वन थिंग दैट इज नेचुरली ठीक हो जाता है. प्री प्यूबर्टल एक्ने 8-9 ईयर्स बॉय गर्ल का होता है. टिपिकल इस टीनेज का जो होता है फ्रॉम 12 to 19, 20, 21 खत्म हो जाता है उसके बाद. दैट इज द कॉमनेस्ट acne vulgaris. Do you have any idea how many people in the world have acne?
No.
About 65 crore, that is 650 million. On a rough estimate, like
at this point,
this point, when I last checked, it is about that. About 9.5% of the world population. Like in female, it is presumed that it's 9.8, and in male it is 9. But we are not sure because female, they are more like a conscious about their pimples and appearance. They report to the doctor more. If you compare with a boy, so 9 and 9.8, it does not mean anything. But 9.5% to 10% of the world population. If it is 755.
It means like almost 1 out of 10 people.
Yeah, 1 out of 10. And for India also, we have 144 crores. So on an average, we have 15 crore people suffering from acne. So that is also a very interesting thing. This is one. Acne vulgaris. Nothing to do with vulgarity here. Vulgaris means common acne. Vulgaris means common. 80 to 90% human being walking on this planet had acne ever. So it is the 8th common disease, if you call it as disease. It's 8th common disease in the globe at any point of time. Sometimes young lady comes to, Dr. Sahab, ye acne hai ya pimple hai? So I asked that, what's the difference between acne and pimple? I asked, को पता नहीं है डॉक्टर साहब ये एक्नी एंड पिंपल. वो पिंपल जो होता है ना वो छोटा पिंपल होता है, एक्नी जो थोड़ा पास फिल्ड हो जाता है वो एक्नी होता है. सो दैट इज हाउ दे डिफरेंशिएट द कॉमन पीपल. बट फॉर अस very easily we differentiate. It is mild, moderate or severe. Mild is just a
acne or pimple same hota hai?
Yeah, same. Acne is a Latin term. Pimple is an English term. That's all.
Okay. So it's like mild, severe?
Mild, moderate and severe. Severe is the pus filled and the jo cyst ho jata hai, nodular cystic. But the most important thing, and I forgot about the adult acne, which is always related to ovarian cyst and in case of lady. And in post-menopausal, kya hota hai that the female hormone gets off. The male hormone is there. It's not increasing. But due to the male hormone, after 50, 55, sometimes the female starts getting it. The most important thing we should, I highlight, I think, it is these days, suppose when you were in your school days, how many of your classmates were hefty? Now, 80 to 90% are overweight or obese. Only 1 out of 10 is normal weight, right? Or 10 or 30 years back, अगर क्लास में एक मोटा तो वो मोटा है. Now all are overweight. This obesity, this metabolic syndrome, this is related to acne. This sudden increase, because in case of young females, 14-year-old girl or 15-year-old girl, weighing about 80 or 90 kilo, with a frontal hairline receding, यहाँ पे acne, that is the lower face is having acne, extra hair, the hirsutism, some period irregularity, very easily they are getting tanned. These acne, we can just ask, and the hair is getting thinned. We just ask, do you have ovarian cyst, PCOD? So they are blissfully unaware because their period is normal. So we just ask that करवा लो, एक अल्ट्रासोनो करवा लो. So they are shocked to know that they are having ovarian cyst, PCOD. So always in 60 to 70% case, a dermatologist diagnose a case of PCO and refer to an endocrinologist. So this part should be addressed, because most of the time this is a part of the hormonal influence from inside the body, which we were not aware like 15, 20 or 30 years back.
So this happens to young adults or this happens to mostly teenagers?
Teenager and also young adults, like after 25. If someone after 25, तो ideally pimple नहीं होना चाहिए. 25, 30-year-old एक लड़की या it should disappear. That is not the age of pimple. But अगर फिर भी आ गया, the lower part of the face is involved, pre-menstrual flare-up, every time before the period it gets increased, And again, that जहाँ पे भी हो जाता है वहाँ पे एक spot आ जाता है. So these are all pointer that you have something inside. And for male also, they are 100 kilo. They are very easily getting tanned. This neck area is black. The underarm area is black. Acanthosis nigricans. They have pimples all over. And his brother, who is lean and thin, just like you, never had pimples like your skin.
Interesting. So weight and obesity is directly related to acne and pimples.
It is. Lifestyle disease, yes. This way, if you tell that fried food nahi lena chahiye, now I'll come to 180 degree from what I told before. Yeah. Yes, you need to curtail your food. You need to take healthy food to decrease your body weight. But agar beech mein you want to take biryani, you go ahead with that.
मेरे खाने से मेरा वेट बढ़ेगा, मेरे वेट बढ़ने से मुझे एक्ने होगा.
Exactly.
मेरे खाने से डायरेक्टली एक्ने नहीं होगा.
No. Okay. Exactly. Correct.
Okay. How do you treat pimple, right? इस पे बात करते हैं. क्योंकि मार्केट में प्रोडक्ट्स मिलते हैं. एक होता है एंटी एक्ने फेस वॉश. Does that work?
Yeah, definitely. And anti-acne face wash we also give, but that has to be basically it should be anti-comedogenic. It should not be non-comedogenic. Whatever it is.
What do you mean by
comedogenic? Means the comedon, the basic, the blackhead and whitehead. You know about it. The blackhead is the open comedon which has oxidized and becomes pigmented, blackened, and the whitehead is a closed comedon. Just a tiny bump on the skin, which is yet to become a papule. That is the initial initial focus. So it is very, very structured kind of therapy.
So you mentioned, let's make it easy for people to understand. Okay, there are 3 types of acne.
Yes.
You said mild,
moderate, and severe.
Moderate and severe. So mild, सिर्फ फेस वॉश एंड क्रीम्स से ट्रीट हो सकता है?
Mostly yes. Mostly you don't need to go to a doctor.
Okay.
So let us make life very easy. So it's not that every time you go to like a dermatologist, you do not need. You just purchase a good face wash. You just cleanse your face and moisturize your face. That is also needed. If that helps, fine. If it is a moderate acne, what is a moderate acne? That is that tiny little dots is increased and there is a pus inside it. That pus means there is an infection.
अच्छा.
So whenever it's infected, you need to consult a doctor. You should not do this.
So एक हो तो भी जाना चाहिए?
Yeah, definitely. Because
it's just a type.
Yeah.
And mild में let's say बहुत normal दिख रहा है. This is mild or moderate?
Yeah, this is actually a pustule.
Okay,
this is a pus filled. Yeah.
Okay, so this is moderate.
Yeah,
so let's say बहुत ही mild, normal अगर कुछ होता है इससे बहुत कम, छोटा सा, and वो 5-6 हो जाते हैं.
You need not take any antibiotic. Here only the topical antibiotic is enough for this.
Okay.
If it is more than this, you need to take systemic antibiotic. And if it is too much oily and you cannot handle it, then you need to take the isotretinoin, the oral isotretinoin, to make it dry. So that everything is cleaned out. Initially क्या होता है, लगाने के 2 दिन के अंदर ठीक हो जाता है. And you always think that this is the thing. और you tell your friend to आप ये लगा लो ठीक हो जाएगा. And you don't know that after applying this 3-4 और आ गया, फिर अब लगा लिया, वो भी ठीक हो गया, फिर 4 दिन पर और 10 हो गया यहाँ पे. So that starts the GP, the geometrical progression. So that we are a little worried about.
Okay, so ये spot corrector से सही हो सकता है?
Yeah, definitely.
Spot correctors use करने चाहिए जो market में available है?
If it does not contain any steroid, it is okay. Most of the time it's niacinamide, the glycolic acid, the alpha hydroxylic acid,
salicylic acid.
These are there. There's nothing wrong in that.
Okay.
These are accepted.
So spot correctors work if it's a good one.
Definitely. Yeah.
And then the severe वाले acne. Okay, तो severe वाले acne में medicines are compulsory?
Absolutely compulsory. And compulsory, that is, you need to go to a proper dermatologist and who is either with a DVD or MD or DNB in dermatology, who is a practicing dermatologist in India. And not, again, a Jola chap, because you need to differentiate between a Ayush physician and a proper dermatologist. And then you take the medicine, whatever, and do not continue that medicine for a period which is not written in the prescription. उसके अंदर 6 हफ्ता लिख दिया, and you are going back to the doctor after 6 months.
The problem है.
And that is difficult.
So isotretinoin usually लोग देते हैं, right?
Isotretinoin in proper dose.
So
and उसके साथ, other than isotretinoin, we give doxycycline, we give azithromycin, we give limecycline, we give minocycline. These are the antibiotics.
But usually it's isotretinoin, right? Yeah. Isotretinoin is very commonly used to avoid pimples.
Yeah.
ये बिना डर्मैट के ले लेना चाहिए?
नहीं, कभी नहीं.
और इसके साइड इफेक्ट्स क्या होते हैं?
देखो, isotretinoin in the global stage, they will not get without any prescription, because you are not sure whether that girl is pregnant or not. If it's someone who is pregnant, isotretinoin ले लिया, that can give rise to the deformity in the baby. So we don't want that. Sometimes it causes depression. So that is and suicidal tendency. We have seen that is reported. Fortunately, in India, we have not faced that, probably due to the family cushioning effect here, and we don't give in that dose, 60 milligram, what is given in Western world. We give hardly 20 milligram per day. But yes, suicidal tendency is also reported.
And in men, when you search about isotretinoin, they say it leads to erectile dysfunction or infertility. Is that true?
No. There's no evidence about
if you use it for longer time.
No evidence. Absolutely.
Isotretinoin के अलावा कोई और ट्रीटमेंट होता है सिवियर एक्ने का कि नहीं? सिवियर एक्ने तो दवाई लेनी ही पड़ेगी.
These days now we have many things like benzoyl peroxide के साथ that's a wash भी आ गया. Topically भी retinoid होता है लगाने के लिए. That is, we all know about the topical retinoids. लगाने के लिए retinoic acid जो होता है, adapalene होता है, and the latest is trifarotene. The trifarotene is the latest in the market, and that is wonderful. It is costly, but for the back acne, our young patients, we always tell back acne ho gaya. So initially we never knew what is back acne. So that's a lovely little term, the back acne. And it always leaves scarring. I mean, not exactly scarring, the post-inflammatory hyperpigmentation, the pigment spot aa jata hai pet mein. Nobody likes the back. Young girls and young boys, they don't like the... The trifarotene works two ways. One is they take care of the inflammation, that treats the acne part, and the pigmentation is also erased. So that is a very good option.
Which is over the counter or is it prescribed?
It's not. It's prescription product. On the face also you can apply, but you need to apply very little amount.
That's like steroid?
It's not steroid. It is tretinoin. It is the same group, our retinoic acid, our adapalene, and this trifarotene. The same group. It has nothing to do with steroid.
But कोई addict हो सकता है उससे?
No.
So you said oily skin होने से एक्ने होता है, पिंपल होते हैं. किसी की बहुत ड्राई स्किन होती है एंड उसको भी एक्ने होता है. तो ऐसे क्यों?
Actually, that dry skin, what you think is not exactly dry, it is too much of oil getting kicked. Sometimes someone tells us, Dr. साहब मेरा इतना ज़्यादा dandruff है, पूरा dry, scalp तो dry है. इतना ज़्यादा dandruff. Dandruff means oily scalp. It is not exactly a dry scalp. Okay. You think it is a dry scalp. The same thing happens with acne. The person who is telling my skin is always dry because it's always in the air condition. The kicking of the extra sebum, the oil that is getting deposited on the skin, and he thinks that it is dry. It is not dry. It is more oily than others.
I had a question. At what point acne becomes a disease? Does it get to a point where it becomes so serious कि अब ये ongoing and you have to live with it?
Very good question. Disease means when you are not ease within yourself, at that point it becomes disease. We have all kinds of things like a person who has just one pimple, a simple papule, and always is coming to your clinic, is sending you text, is calling your front desk, Dr. Saab, ye ho gaya, yahan ho gaya, yahan pe ye ho gaya. This is one subset of patient.
कितने होते हैं ऐसे patients?
I'll say about 40% of the
people are like that. They are panicked about their skin 24/7.
Even one pimple is not acceptable. And there is another subset who has nodular cystic acne and like a multiple pimple all over the face, and they are not bothered. So absolutely, they're not bothered, and it's okay. That's fine. So it is very difficult to say when people should come to you. But these days, as a doctor, we tell all kinds of scars are actually preventable. If you start the therapy at a proper time, the proper therapy, scars should not happen. Scar means the gadha. Scar is not that, pigmentation is not scar. The common people tells, Dr. Sahab, yahan ek scar ho gaya. वो scar नहीं है, वो pigmentation है.
Okay.
जो गड्ढा होता है ना, जो that is the scar.
Scars ठीक हो सकते हैं?
Scar ठीक हो सकते हैं. That we also take care with the lasers and peelers and everything. We
Time लगता है लेकिन
yeah, definitely. 60-70% it's recoverable.
It's it's there.
Yeah.
Okay. A lot of people, you said कि stress से acne होता है. लोगों को acne की वजह से भी stress होता है.
Yes, very good question.
Psychological effects of acne are too much.
Too much. Yes.
What have you seen few cases?
Yes.
What happens?
We have a chapter on like a psychological effects on skin. Actually, the psyche and skin, these are very closely related. You'll be surprised to know that when we were in the mother's womb, the pluripotent cell, from the same cell, our nervous system and skin develops. So there is a link. Whenever the skin is not feeling well, your mind is also not feeling well. When your mind is not feeling well, the skin is not feeling well. It happens.
That is true.
Absolutely. Someone who has a pimple over here or a white patch over here gets mad. And he may not get mad if he has blood sugar or blood pressure or kidney problem. किसी का पता नहीं चलता है. But यहाँ 3-4 पिंपल आ गया, यहाँ पे एक white patch आ गया, he'll get mad.
क्या हो गया? Panic mode.
Yeah, panic mode. And we have seen many cases like these are the formative years, like a 16-year-old girl or boy. And what we are telling that every time they are in front of their online classes and a young adult, young entrepreneur or anyone, always in front of the computer,
screen,
Zoom and all this, you are on the visual platform always. So you need to look fresh. So that is again a stress that every morning I need to be fresh. And the millions are watching me and they are looking at me, अच्छा उसका यहाँ पे देखो. So this is a stress. A 45-year-old person may not be that serious about it. A 15-year-old boy is always very much affected by it. His academic grade gets deteriorated. They get depressed. And sometimes we need to take the help of a psychiatrist to help them. This is very, very important factor.
But should 14, 15-year-olds start getting treated for pimple?
Absolutely, yes.
At a young age. Like if you give them medicines, isotretinoin, antibacterial things.
That is again not correct. What a doctor will decide. Isotretinoin is not the first line therapy. First line therapy is the proper application of medicine topically without the steroid, taking a proper like a cleanser which is non-comedogenic and applying it. The moisturizer, correct barrier corrector moisturizer, correct sunscreen, which is about 15 to 30 SPF. It's not needed more than that. The sunscreen should be either titanium dioxide or zinc oxide. And that is, again, should be cosmetically acceptable, not like Alan Donald applying some white like a patch on the skin. It should be proper, but these are needed.
Okay. There's also saying that birth control pills causes acne.
Not really. Actually, birth control pill, sometimes it cures acne. Because,
it cures acne?
Yeah. The PCOD for polycystic ovarian disease, the birth control pill, the correct combination of different hormones, that is needed. And many times the parents are very anxious. 17 साल का लड़की and कोई endocrinologist ने दे दिया and they have Googled and they knew that this birth control pill. So the father is asking the mother, do you think this is correct? The mother is asking her next door neighbor, ये देना चाहिए कि नहीं? And they never ask the doctor. So, but this is the correct and ethical approach because the doctor's idea is to, again, doing the correct thing about the regulation. The hormonal imbalance को regulate कर देते हैं. This is for a few months or years and after that it will be stopped. And if you not correct it, the person may develop like a hirsutism, the excessive hair growth, and other complications.
Here's my last question, because we've discussed like a lot of myths. Pura cosmetic industry hai, and there are thousands of products which are available outside. I can go, if I have acne, I can go right now to any shop and like buy anti-acne face wash from a large good company, medically proven, whatever, and I can start using it, right? But that may not be right every time. So at what point should somebody go to a doctor for acne?
Over-the-counter products are to some extent okay if it is from a big and reputed company with like a multinational base and for many years they are serving the people. There's nothing wrong in that. But when there is a new company without any base and some influencer on YouTube is telling ye lagao, wo ab laga liya, that may harm your skin. That is one. But
why? Because
you don't know about it.
But there can be a new company who's doing right thing. And
absolutely. But you should not be the guinea pig. That is what I'm telling. But it is your skin. You applied on your skin and you burnt your skin. So that may not be the correct thing. That is what
if you won't trust a new company who's coming with all the certifications and all the right formulation, right things, how will that company will ever become big if nobody will trust them?
We always tell that this is a correct question. Don't apply on your face first. Suppose you want to try a new product and you are very convinced that it will work. Apply on the back of your ear initially, back of your this elbow overnight, and see how your skin is reacting. If it is absolutely okay after 12 hours, then you can apply on your skin. So that is the very common thing we tell our patients.
Nice.
So if anything happens
new
over
product,
here,
apply here and here.
Yes. And if something happens here, you can always go to the doctor and get it treated. But if you apply over here and something is wrong, so you are in soup, right? And number two is whenever you feel like going to a doctor, you should go to a dermatologist for your skin problem. For your skin problem, you should not go to a dental surgeon.
People who goes to any other doctor? People do go there?
Yes.
What kind of doctors do people go to?
So because
GPs?
For every one skin doctor, there's at least 10 to 20 people who are quacks in India.
And by quacks you mean जो बिना डिग्री के कर रहे हैं कि वो बोलते हैं कि मैं सब करता हूँ, सब मेरे से ट्रीट करा लो.
Yes, बिना डिग्री, some without MBBS, some are maybe history honors, maybe chemistry honors, whatever, and वो कोई स्टूडियो लगा के बैठ गया and they are doing everything under the wall.
Really? There are people who say that I'm running a skin clinic.
They do hair transplantation also. We face everything.
Hair transplantation, I've heard that a lot of random people have started doing. Yeah.
And if they can do hair transplantation, why they can't write something wrong on your skin which will ruin your skin? So be sure that you are going to a proper dermatologist, and whenever you think that you need to you are concerned about it, that is the correct time.
Okay.
But you should not ignore, or you should not think that ठीक हो जाएगा, दो तीन महीने ये लगा ले तो ठीक हो जाएगा. ऐसा कभी नहीं होता है.
How to identify the right dermatologist?
Yeah, a dermatologist means who has a DVD or a MD or DNB in dermatology, and who is a member of Indian Association of Dermatologists, Dermatologists and Laboratories, that IADVL. So it is easy. So you just identify by that.
So if I Google right now, dermatologists near me skin
and
doctors near me.
Be sure that he is registered with the local.
How do I find that out? So
it is
skin
always
doctors
mentioned.
Near me. Abhi मैं search करूँगा और ऐसे 10-12 लोग की ad आ जाएगी.
It is mentioned. So, and suppose you are in Maharashtra, you go to the Maharashtra Medical Council, search the doctor's name. मिल जाएगा.
Okay.
And if he is a quack, उसका नाम नहीं होगा उसके ऊपर. That's all.
So that's all you need to do in Maharashtra. Yeah. And then
all over India, in every state you have medical council. You go to the medical council and search the doctor's name.
And someone who studied from, let's say, America, will that person also be registered in an Indian council?
So if it through some certification course, government official course, if he passes that course and is authorized to practice in India, yes. Otherwise, no.
Perfect. Thank you so much.
Thank you. Hi.
How are you?
Good
Pleasure meeting you.
Yeah.
I've been hearing a lot about you.
Really?
Yes.
Okay. So my son is doing his film and media in Scotland. When I told that Raj invited you, oh, are you sure? Is it Raj Shamani? And I guess I was watching some of your episodes.
कौन सा देगा?
Mainly on the medical aspects. I'm very happy that you stick to the science and the evidence, and you don't promote anything bullshit, anything without any evidence.
Yeah.
But you are doing a great job. Congratulations.
थैंक यू सो मच. थैंक यू सो मच ये एपिसोड एंड तक देखने के लिए. अब आपको 3 चीज़ें करनी है. सबसे पहले इस चैनल को सब्सक्राइब कर लो, क्योंकि जितना आप सब्सक्राइब करोगे उतने ही बेहतर और वैल्यूएबल गेस्ट हम ला पाएंगे आपके लिए. नंबर 2, मुझे कमेंट्स में बताओ इस एपिसोड में आपको क्या अच्छा लगा और क्या गंदा लगा, ताकि हम वो मिस्टेक्स रिपीट ना कर पाए. एंड कौन से ऐसे गेस्ट हैं जो आप देखना चाहते हो वापस हमारे पॉडकास्ट पे, ताकि हम उन्हें लेके आएँ और आपको ज़्यादा से ज़्यादा वैल्यू दे पाएँ. एंड नंबर 3, ये एपिसोड किसी एक इंसान के साथ ज़रूर शेयर करना, क्योंकि one conversation can change someone's life. I'll see you next time. Until then, keep figuring out.